The, the cleaning contractor could not maintain the spaces.
Who was the cleaning contractor?
I think it was Be Clean. It's always been Be Clean, and they've just expanded to the point where now they have taken over. Like, so all the cleaning is out now, right? That went out in summer of 2021. I don't know how many people were in that building at the end before they contracted out, right? I mean, interestingly, Be Clean puts a lot more staff on shift because they pay them less. They can afford to. Their cost, per person or per square footage is less because they're not compensated the same way. Now they're also doing a different job. The job has changed over time from cleaning the lab, emptying the garbages, mopping, sweeping and mopping the floor every day, cleaning the sinks out every day, and emptying our ashtrays. Tell you back in the day when we used to be able to smoke in the lab, right? Lab that had ether in it, but whatever. Sorry?
Is it still a unionized job?
Which?
The Be Clean's job?
No, they're not unionized. Okay. Right? I mean, that's part of it. So they've gone to now where I think they empty, if you're in an administrative office, they empty your garbage once a week. If you really want your garbage emptied, there's a big bin at, by the elevator in the foyer. Yeah, you can go and dump it yourself. I don't know if they actually sweep the floors of offices anymore. Maybe it's once a month. So what a difference. Like the hygiene levels have just deteriorated. Just deteriorated. Even the stairwells, things like that where it needs to be clean, because if somebody, I guess they were really lucky. They never had to slip and fall in a stairwell because of, sand or dirt or whatever. Mm-hmm. Yeah, I'm going to tell you that I don't believe there was equivalent pay. I don't think there was equivalent working conditions, because I don't believe that Be Clean, because they didn't have to, they didn't have a collective agreement, they were a private entity, treated those people in terms of remuneration anywhere close to our members were being treated. The level of hygiene of the clinical rooms, patient examining rooms and that kind of stuff. It's got to be to a certain standard. And the university, frankly, was good at educating their staff about the standards, about the hazards. The WMIS training was done to that. They fell in with the regulations in terms of making sure people were educated and oriented, even if English was not their first language. And they made sure, right? Yeah. I don't know that Be Clean does the same thing. I haven't really talked to anybody that works for Be Clean in terms of the level of education they get or not. But facilities and operations I think because of their approach, working with tradespeople, working with that kind of environment, there's a different kind of commitment to health and safety. I think it's part of their trades kind of orientation, right? Like, because it's that whole thing about go to work but go home at the end of the day in one piece, right? Go home with your health. And the most terrible part, I think, and I think this is about the university too, that the university has lost touch with its place in Alberta and in Edmonton society. It's a public institution, but the public good it can do is beyond the education it provides to students and the research it does, right? Mm-hmm. It's a public institution, it has public monies, and what it did at one point was hire a lot of marginalized workers, whether they were people with disabilities or what we now call new Canadians, immigrants, right?